turn it over to Executive Summers.
Oh, thank you, Heather. Good morning, everybody. Thanks for joining us. So, as you know, we're really experiencing the highest spike in cases that we've seen since the start of the pandemic. And as in the past, we really have two goals in mind, critical goals. It's keeping essential operations functioning, including our healthcare system. We're going to hear a little bit more about that, and limiting disease and death in our community. So as more people have become infected, the increase in demand for COVID tests has really skyrocketed. And we really recognize that we need more capacity to ensure people can get tested when they need to. It's important to families, important to our school system, it's important to our businesses. It's just a very critical piece in our response in dealing with this spike in cases. So I've asked the Department of Emergency Management at Snohomish County to begin the process of purchasing an additional 150,000 home test kits. These tests won't really solve the problem of high demand, but they should help ease the burden and relieve some of the pressure on in-person testing sites. Also, really, home tests give people an option that doesn't require them to risk exposure to COVID at a public test site. Although that risk is low, it does give an at-home option. So those kits are going to take a few weeks to arrive. We're working on a distribution plan, and we'll have more information about how those kits will be distributed throughout our community in the coming days and weeks. So stay tuned for that. We're also exploring other options for both testing and immunizations. And I know Dr. Spitter is going to address that, but we're hoping to have some more announcements of that in the coming days also. And, you know, this has just been a tough spike. It's critically important we continue to work on our safety measures, social distancing, masking, immunizations are still very, very important. So I'm really proud of the partnership we've had with the health district and our health care system. So we'll just keep going on this. So Dr. Spitters, I'll turn it over to you.
All right, well, thank you, Executive Summers, and good morning, everyone. First, to follow up on a couple of items Executive Summers referred to, we are still awaiting final details from the state on the at-home test kits mentioned in the state's press conference last week. But meanwhile, we're working on preliminary plans for how to distribute them in an equitable, effective, and efficient manner. Meanwhile, in addition to the efforts by the county to purchase test kits, the health district has also placed a purchase order for an additional 100,000 kits for distribution through similar channels. And we continue working with the state to identify additional opportunities to further increase testing capacity in the county during this surge. Those test kits will bring some relief to those spending days trying to find an available testing slot, but that is still 3 to 4 weeks off when we expect those kits to arrive. We've been working with the State Department of Health and the federal government to try to expand vaccine and testing availability. And I'm happy to tell you that Snohomish County has been selected as a location for an indoor mass vaccination site that should begin operating roughly toward the end of the month. Final details are being worked out, and we will disseminate more information as it becomes available. Meanwhile, don't stop trying to get those boosters through the existing system. Make an appointment as soon as you can within the time frame of your eligibility. Again, that's 5 months after completing an mRNA or the Moderna or Pfizer primary series, or 2 months after receiving the Johnson & Johnson vaccine. Based on questions last week, I thought it might be helpful to show some updated figures on the recent course of the pandemic in Snohomish County. So I'm going to share my screen here for just a minute. There we go. All right. You don't need to be an epidemiologist to know that we've got a problem here. If you, there's the course of the epidemic since the 1st of last year. So this is the last 52 weeks. And you can see that we've had successive doublings in the past 4 weeks, up to nearly 11,000 cases reported in Snohomish County residents last week, up from roughly 5,000 the week before. When we translate that into that 2-week case rate, it looks like 2,000 Snohomish County residents for every 100,000 got infected in the past 2 weeks. So that's 2% of the population became a reported case. And when you also factor in people who were asymptomatic, who didn't feel sick enough to pursue testing, or who pursued testing but were unable to get it, that's probably more like 8 to 10,000 people, or 8 to 10% of the population probably got infected in Snohomish County with Omicron in just the last 2 weeks. So really staggering numbers that really do blow the lid off prior peaks in the pandemic. Just to give you an idea, this is a different time frame. Look here at the bottom. So this is not the past week or two. This is the month of December. But just to give you an idea where the cases are occurring, predominantly in the young adult years of life, 20 to 49, but also in children and youth. Don't let that somewhat smaller number in teenagers distract you. They've got a smaller population too, so their rates are still high. So we see the highest rates in these younger age groups. Fortunately, not as much in the older age groups, particularly those over 70 who are most at risk for severe disease and hospitalization. We'll hear more from Dr. Cook in just a moment about the hospitals, but I did just want to touch on this. This looks countywide at all 4 hospitals, the number of beds filled by COVID patients beginning December 24. So what would that be? About 17 days ago, up through yesterday. And you see a steady increase up to 176 patients with COVID in Snohomish County hospitals as of yesterday. About 10% of them, 15, are in respiratory failure and on mechanical ventilators. Roughly 0 to 2 patients dying per day in Snohomish County. That you can see that these figures eclipse the prior peak of hospital census due to COVID that was experienced about a year ago. And also, as important as this is about the course of the pandemic, it's important to just keep in mind total hospital occupancy is running very high in Snohomish County. Generally, we like to see that at 90% or less. So there's very few available beds, and this COVID surge has placed pressure on the system to provide care that challenges the ability to meet the care needs of all individuals. Now, just a couple of updates on projections. These are newer projections compared to what I alluded to last week, and I wanted to show them to you this week. Last week, the Institute for Health Metrics and Evaluation at the University of Washington was predicting a peak in infections later this month, with a peak in hospitalizations early next month. But I think the recent history where we've seen this dramatic increase over a short period of time led them to rerun and update those projections. Now, these are projections, these are not promises, but this is just a general idea of the course of where we may be. This dotted vertical line is where we are now, anticipating maybe another week or so of increasing case rates still, and then coming slowly down the other side, hopefully over the course of a couple of months. So that predicts a peak in mid to late January with infections, late January, early February with hospitalizations. And again, look at this, the difference in this peak. This was our last peak in the fall, substantially higher, almost doubling, which is already what the hospitals are seeing in Snohomish County, substantial increases. And then deaths, this solid line that's rather jagged is actual deaths, and then the dotted lines are projections. Again, hospitalizations trail infections by 1 to 2 weeks, and then deaths trail hospitalizations by 1 to 2 weeks. So more toward mid-February, we would expect to see a peak in deaths. And it depends on how severe the Omicron variant is turning out to be. Again, no promises, but we're probably down in this territory here. This would be as if Omicron was, as virulent as Delta, but experience so far suggests that it's a bit less. We're certainly seeing a smaller proportion of patients ventilated. That's another reassuring signal. But overall, that's the course of where things are headed. I'm going to come back to you all now, and just a couple more remarks. So although this paints a picture that's rather bleak and overwhelming, it's conceivable that although the worst is ahead, it's not too far off, but we do all need to kind of hold it together, exercise restraint and discipline, and follow all those prevention measures we've been mentioning and that Executive Summers mentioned earlier, particularly getting that booster, wearing a mask at all times, and using a higher quality of mask whenever possible, either medical procedure mask or a cloth mask over a medical procedure mask, or one of the higher grades of K95 or KN94 masks. I also want to mention, I didn't allude to what's going on with the long-term care facilities, but there also we're seeing cases and outbreaks there. Remember, there was a point last summer where we had zero activity of COVID in the long-term care facilities. Whereas now as of yesterday, we had 63 facilities with one or more cases, and the total number of cases among staff and residents in those 70 facilities is about 250 to 300. So that's also going on. Last Friday, we issued a press release and a joint video message in partnership with local healthcare leaders, trying to convey how dire the situation is. Having observed the healthcare systems closely for the full course of the pandemic, I must tell you that at no time has the healthcare system status been more precarious, and each of our access to acute care been in greater peril. To tell you more about that from the front lines, we're joined today by Dr. Jay Cook, the Chief Medical Officer of Providence Regional Medical Center here in Everett, the largest inpatient facility in our region and the provider of care for the vast majority of hospitalized COVID patients in Snohomish County. Jay, thanks for joining us. Please take it away.
Well, thanks very much, and good morning, everyone. I really appreciate the opportunity to be with you this morning, and appreciate the partnership, the really strong partnership that we have with the Health District, and appreciate Executive Summers and Dr. Spitter's efforts to bolster our testing and our vaccination capabilities across the county. That's incredibly helpful. As Dr. Spitters mentioned, in the past 3 weeks, we've really seen a dramatic increase in COVID cases in our community and also in our hospital. And in fact, since Christmas Eve, the number of COVID cases at Providence Everett has increased 5 times in just that short time. And the number of COVID cases that are sick enough to be in our intensive care unit over that same period has increased 3 times. We still see, and this has been consistent throughout the pandemic, that about 90% of the patients who are sick enough to be in our intensive care unit are not vaccinated. That has been consistent, and I just verified that yesterday. The other thing that is different about this surge is that the Omicron variant, of course, is the predominant strain now, and it is very transmissible, and there has been a marked increase in our caregivers who have either been exposed or infected to COVID, which is really impacting hospital staffing, and I'll say also staffing in every healthcare facility in Western Washington. A growing number of our hospital workers have just not been able to come into work because, as I've said, they've either tested positive because of a significant exposure, oftentimes within their own family or someone they know well, or they've had an exposure to to someone in their family or friends. Those people who get vaccinated, while they can certainly contract COVID, it's vast majority of the time it's a much milder case, and it does not cause severe symptoms or require hospitalization. Our caregivers have demonstrated what has been true. We've seen throughout the Washington and the whole country that vaccinations work to prevent severe disease, hospitalization, and death. And if anyone listens who has not been vaccinated or has not been boosted, I would strongly encourage you to do so. Because of the historically high census, hospital census that we've experienced recently, and our challenging staffing situation, Prov Everett has set up an on-site emergency command center to coordinate the staffing, supplies, and resources needed to make sure that patients can receive the safe care that they need. And this has been helpful in communication and coordination since we stood this up roughly a week ago, could be a few days more than that. For the past, some other things that we have done to manage through the challenges that we face. For the past 10 days or so, we have postponed all non-emergency surgeries and procedures at Prov Everett. These are not trivial procedures. These are essential, and they need to be done. But the doctors and we have determined that it's not likely to cause harm if they are postponed for 2 or 3 weeks. By that time, we anticipate and hope, given the latest IHME estimates that Dr. Spitter shared with us, that we can resume these, but we are evaluating our capacity to do this on a week-to-week basis. The staff from these procedural areas are being temporarily assigned to other acute care units to help backfill the staff who are not able to work because of quarantine. And that actually has been extremely helpful in filling some of the shortfalls that we've had in all units throughout the hospital. We've also opened alternative care sites in non-traditional areas on our Colby campus to take care of the large volume of patients. As yet, we've not had to use non-clinical space such as conference rooms. You've seen, I'm sure, pictures and read stories about other facilities using those kind of non-clinical spaces. We have not gone there yet, but we are using spaces that are not currently used in our procedural areas and other space that patients are in, just not usually for inpatient care, in order to provide the safest care that we can to the large volume of patients that we see. We've also, once again, unfortunately, had to limit visitation in the hospital, including the emergency department, to limit the exposure of COVID to our staff and our patients. And very importantly, and I think this is something that does not get enough attention, Providence and other healthcare facilities across the state are working with our state agencies to reduce the large number of patients who reside in our inpatient units who no longer need acute care. At Prov Everett, we currently house over 100 of these patients, and that represents about 15% of our total licensed bed capacity. These patients would be much better served in a skilled nursing facility, adult family home, or some other non-acute care facility in our community, but they face barriers to discharge, such as regulatory, financial, or sometimes behavioral challenges. And the post-acute care facilities face staffing challenges of their own, just like the hospitals do. So it's very difficult for us to transition these patients who no longer need the high level of acute care to more appropriate levels of care due to those factors. While they're with us, we obviously have to give them much the same level of staffing and treatment as we do our other inpatients. And so that has proven to be a challenge for us as we face the staffing and the bed capacity issues. And our leadership continues to meet with state officials, and we're working hard to find solutions that will help us direct our limited resources towards those patients who really need the acute care that you can only receive in a large a referral hospital such as Everett. So hopefully in the future, I'll be able to report some progress on that. And finally, I would just ask folks to remember that the emergency department really is for sick people. And we're asking those folks with mild symptoms to just isolate at home and seek care from their primary care physician or perhaps a walk-in clinic rather than coming to the emergency department. Of course, severe symptoms, shortness of breath or dizziness or other thing that's more than a head cold or sniffle symptoms, we definitely want you to look for care in the emergency department. But for those with only mild symptoms, it will be much better for you and for everyone to seek care outside of a crowded and often chaotic emergency department. So with that, I will pause and look forward to trying to answer your questions later. Thank you.
Great, thank you, Doctor. And just our deepest thanks to everybody working in healthcare. I know you've been under tremendous stress the last couple of years, and both the system and as individuals, and very much appreciate it. And it's amazing work, but thank you. A couple questions in chat. So World Health Organization is now projecting that half of Europeans may get Omicron. Is that where we are looking at in Snohomish County in the near future? I'll throw it over to either of you.
Well, in short, sure. I've heard projections of 40%, and I just mentioned, rough estimate somewhere around 8 to 10% got infected in the last couple of weeks. The week or two before that, I think it was 3 or 4%. So right there is 15%, and we've still got a little ways to go at the top, and then we're going to come down the other side. So you add up those pieces together, and somewhere around a third or a half is probably about right.
Yeah, I would agree with that. I mean, it's impossible to say with certainty now, but I think that's a reasonable expectation.
So there's a little bit of a follow-up note, comment on, I'm hearing more people say that we're all going to get Omicron, a growing sense of frustration despite precautions. And, maybe I'll weigh in. We talked about this last year, that I think everybody should assume that they're going to be exposed and have great potential of getting one of the variants. And so the best course of action for good outcome is to get vaccinated. I had both shots of Moderna and a booster before Christmas. I got it. It was very mild. It was 3 days that I could tell something was going on. And that's the outcome we would like to see. Mild cases, not a burden on the healthcare system, but that's, I think, benefited greatly by being vaccinated. So that's the bottom line for me. Dr. Spitters, you want to add to that?
Well, yeah, I think you really covered it, and there's a saying that don't let pursuit of perfection get in the way of doing good, and I think in this context, don't let expectations or hope for perfection get in the way of doing good. Yes, Omicron is overcoming barriers, and people who are fully vaccinated and very careful are still getting it, but they're getting it at a lower rate and less severe than those who are less careful and unvaccinated. And as Dr. Cook just mentioned, with 90% of the ICU admissions being unvaccinated, it just speaks to this is a relative fight that we're in with Omicron. It's not going to be unmitigated victory, but everything you do to mask, distance, avoid gatherings, stay vaccinated, reduces the risk of having severe disease and spreading it on to someone else. So imperfect, but still very good. Keep practicing all those measures.
Okay, Edmonds and other school districts are preparing for remote learning, but this time isolating only for shorter periods, affected classrooms or individual schools. Your thoughts on the effectiveness of that approach?
Well, we certainly, we're in a longstanding partnership with the schools over Omicron, or COVID, Omicron now, prevention and control, and case reports are very high in the schools right now, and we support any school that makes an election to move to remote or hybrid learning. They're really the superintendents and the school community really are the choosers there, unless there's something very dramatic going on where the health officer would have to take action. But I think that we're supporting those measures while at the same time realizing that if the school is able to operate, I think often the reason they're sometimes considering sort of closing the doors or moving off site for a while might be because they don't have enough staff. Similar to what Dr. Cook mentioned happens in the hospitals is also happening in schools and other workplaces. Too many people quarantined or isolated to run the shop. So that's also something to consider. But there's no, categorical thinking one way or the other, like all schools must go remote or they shouldn't do that. I think we have to just work with the schools as we have been and help them get through it. And sometimes they might retreat to remote learning and other times not.
How do we know another variant isn't out there waiting? During Delta, we didn't know Omicron was on the horizon. Is there any concern that an unknown variant will still pop up and extend the pandemic?
Yeah, I would say we know that there are other variants out there. As long, around the world, there is a large population of unvaccinated people who where the virus can take residence, and as it replicates, there are variants that form, and so that's just how viruses work. And so I think we can anticipate more variants. Each one presents its own set of challenges. Some are more contagious, like Omicron. Some seem to be more deadly, like Delta. I think that, again, the key here to prevent hospitalization and death is to get vaccinated and boosted. So far, those measures have shown to be the single best tool we have to curb the pandemic. There may need to be other boosters as go forward, like the flu vaccine every year. But I think we can anticipate this. Hopefully they won't be as deadly or as transmissible as this Omicron and the one before it, Delta, have been.
Dr. Cook, can you tell us more about the Emergency Command Center? Has Providence had this set up at other points in time?
Yeah, we have. Thanks for the question. So 2 years ago, when we had discovered or was kind of presented on our doorstep the first known case of COVID in the country, we really didn't know what to expect, and no one did. It was still the novel coronavirus, if you'll remember that term. So we definitely set up the command center as a way to coordinate communication and resources and staffing and all the things we needed, because we really didn't know what to expect after that. And since that time, over the past couple of years, we've set up probably a kind of a modified command center, maybe not staff at 24/7, but maybe staff at 12 hours a day. When we've had surges, we've had like 5 surges now over the last 2 years. But this is, to my memory, this is the one we've had stood up the longest and staffed more completely than others, for the reasons that I've already outlined.
Great. Also for Dr. Cook, can you tell us about incidental cases in the hospital, like people who show up for a broken bone and then test positive? How often is that happening? And are those numbers counting towards our county's hospitalization numbers?
So to answer your last question first, yes. So we count all inpatient COVID cases, whether they are present on admission or whether they happen sometime during the course of the hospitalization. As I mentioned in my remarks earlier, we have a large population, over 100 patients who are inpatients who have not, don't have a continued ongoing medical reason for inpatient care. Many of those patients have been in the hospital for months, if not years, and they are we don't restrict them to bed. They move around, and it's often challenging. They sometimes have behavioral issues and often have other issues that are challenging to manage because they're not really sick. They don't feel bad, so they move around. They don't consistently mask, and they for a while we had visitation. And our belief is, we can't prove this, but given some of the patterns that we saw, within the last few weeks when we've had some outbreaks in the hospital, we believe that visitation has contributed to bringing some cases in, and then it spread, among the unit and the staff and others. So yeah, we've got all the cases that we know of identified. We've got the patients isolated, and others who may have been exposed quarantined under the usual standard public health guidelines that Dr. Spitters has helped us implement. So yeah, we are counting those cases, and we feel like we've got the outbreak under control. But it's a challenge.
Thank you. This is, I think, probably for Dr. Spitters, but when discussing, I think, remote learning in school districts, there was a suggested game plan on what remote learning should look like. Is this a game plan to get infections back down, or is this a strategy with more permanence?
Yeah. Well, in the current context, with widespread transmission occurring in the community, interruption of school activity is not about protecting the community from something that's happening on the school property. It's everywhere now. So it's really, a school wouldn't be closing down to mitigate the impact on society. Possibly, if there's enough, transmission to mitigate the impact on the school population, if they feel they can't really control or interrupt transmission, or more importantly, as I said earlier, they just don't have enough staff to run the school due to quarantines and isolations, or there just aren't enough kids sitting in the classroom to make it worth it. I think that this speaks to, though, as we go forward, you ask about variants and what's the future of this. The future is uncertain. I think additional waves of undetermined severity and duration are likely, but as Dr. Cook mentioned, I think as we accumulate vaccination and infection, and over time, these should diminish in their impact on society. But while we're going through this, we're going to need to not only in schools, but in workplaces and really, you name it, sort of be able to go forward, and then sometimes need to back up for a while to kind of get through a wave if and when another one occurs. And this is an example of that. So it's not a permanent plan, and the content and structure of it, we defer to the educators to handle that part.
I think one last question. Last week, you asked people not to seek testing unless they had COVID symptoms or known exposure. What does that mean for people who need a PCR test for travel? Are you asking these people not to travel for now?
Well, it really is difficult, isn't it? And here we were in the months of November and December, anticipating the holidays, encouraging everyone to go get tested before you're gathering and after you're gathering and before and after you travel. But now there's so much demand due to transmission and illness, and then the need to evaluate contacts, that as a disease control measure, those are the top priorities for protecting health and the healthcare system. And so administrative type testing does have a lower priority. And right now we're most settings are not able to provide tests to travelers. And but there are dedicated private organizations that do cater to travelers, and we encourage you to we can't recommend or endorse any particular organization, but certainly take a look on the internet. You can find them. But yes, this does impose a burden on the prospective traveler, and may indeed, on some occasions, make it difficult or impossible for them to engage in the travel they had hoped or planned to do.
So there was a follow-up on that question. Department of Health is telling folks to stock up on rapid tests, even if they're not sick or exposed. Is that consistent with our guidance?
Well, I'd say I hadn't really considered that, but first things first, I'd say let's address illness and contagion, and stockpiling, in homes. We'll have to consider that as we look at the supply that we both are anticipating coming in, and then what the use is and what the course of this wave is. It may be that in 3 to 4 weeks or a month, the need and demand is way down, and there is room for people to kind of store those up. But I'd take a to be determined view on that right now.
Great, I think that's it.
This is Carrie Bray jumping in with the Joint Information Center. We appreciate all of your questions. We're going to go ahead and wrap up for today, but please do stay tuned for future media availabilities. Thanks, everyone.